I've got Dr. Lee here with us. We did a conversation about non-specific lower back pain. When I was in medical school, the spine surgeon that did a lecture, it was one lecture on back. He got up and he said 85% of lower back pain is non-specific. Now, when you hear that, what do you think?
I agree with it, but it just shows to me that there's a lot of unknown, and we need to, how can we collaboratively figure this out? And I think that's a good thing where people aren't just saying you go to a surgeon, you're going to get surgery, but we need to identify that. We need to identify that it's not just, real easy to figure out the diagnosis.
Yeah, I think it highlights that it is difficult sometimes in lower back to know exactly what's going on. And you talked about collaborating with providers in other specialties to find out the right diagnosis. But that, I don't know what it's been, that lecture has just stuck with me. Like, to me, that's completely unacceptable, that we don't know why somebody is having pain in their lower back 85% of the time.
I think we, as physicians, any other provider, we always want to deliver our product. We want to treat. We learn how to treat. We learn certain things to do. And sometimes that's dangerous, I think. I don't want to be dangerous, but we really need to find out what the problem is. Because even like today, if you start treating and you don't have a clear diagnosis, you can cause more injury, and we don't want to do that. So I think stepping back and understanding the problems with non-specific and finding out.
You showed a small picture. Well, you showed part of a picture, and then you expanded the view, so that as you expanded the view, you began to see the big picture, right? And I think that what's happened is many of us are looking at the small picture. We're looking for, if I'm a surgeon, I'm looking for what I would want to do surgery for, and then everything else is non-surgical. And a lot of the other specialists do the same thing. How can you, in spine management and chiropractic, why are you able to see the big picture maybe better than some of the other specialties, especially surgery?
Even chiropractic, we have our hands to deliver our product, and manipulation is a big part of what we do, but that's a treatment. And I think when we step back a little bit and say what is going on, and looking at it from a ligament pathology in the spine and all the other surrounding connective tissue, once we analyze what's going on with that, then we can deliver certain specific treatment, and we can send out for physical therapy or collaborate with pain management and say diagnostically, let's look at this. And there's lots of ways to deliver the manipulation. There's instruments, so if there's a surgical case, or we can use those to really look at, hey, I want to cause the joint to do this, and that is where we step back a little bit. I think that's our go-to.
Isn't it interesting though that treatment has gotten better and better and better, but I don't know that we're necessarily that much better diagnostically. We're better than we used to be. There's definitely advanced imaging techniques, but it all seems to be driven by what is financially reimbursed. The MRI centers can do better and better diagnostic imaging, but that's kind of their treatment, right? That's what they're delivering. You can do better manipulations. You can do instrumented manipulations. I have lots of things in my armamentarium as a surgeon, and the technology has gotten better and better. But what we haven't gotten better at, I don't think, really, is seeing the big picture and a deep dive into the underlying root cause of issues. And that's where we really need to come together as a community, collaborate, and then have spine management, in my mind, is to be that specialty that can do the deep dive diagnostics, because that's what's missing. Because if you make non-specific low back pain specific, and you know why somebody's hurting, and you can tell their story, and you can say, well, you have this area of degeneration, and over here there's a compensating joint, and then it's compounded by an injury here, and it's not simple. Like, it's not like one problem with one treatment that's easy to see. It's more of of telling the patient's story and understanding the whole context and the big picture. Now you can formulate a treatment plan that's going to be a lot more successful.
I've seen where it's unfortunate, I think, in my career, where insurance or financial decisions do make a decision. I can only do this procedure because insurance covers it, or I can do this injection. Insurance covers this. Many times I speak with the pain management providers of just wanting to get a diagnostic injection. They're like, it's not covered.
Right.
And it's like, wait, this is what we need to do. Is not, they'll pay for a really expensive procedure, but nothing to really diagnose it. And I'm like, that's not really what we want to be doing. And so then we therefore try to develop new different treatment, this option, this gadget or something like that. But yet we're still missing that diagnostic point. MRIs, for instance, MRIs have gotten so much better, but we're still looking at the same thing. And if we can sit back and go, do we have a better way to look at this story a little bit better, I think we'll increase our outcomes.
Well, I appreciate I think that the thing that's going to stick with me is that big picture. When you only see a part of it, you don't know what's going on. And when you expand out to see the big picture, now you see the whole story.
Yeah,
and we need to make sure that we're seeing the whole story when we manage the care for patients.
Yeah.